Hi, I'm Megan. I am a registered vet tech, and today I'm going to help you understand dog medication.
Megan, when will a veterinarian prescribe my dog medication?
Anytime if they have an illness that requires treatment, if they have anxiety, really there's a wide variety of things that they can get prescribed medication for, but most of the time it's diagnostics or behavioral related.
What conditions can medication for dogs help address?
There are a lot of conditions. There is diabetes, there's thyroid issues, anything related to organ values. There's a lot of medication that can help at least correct those values. If for whatever reason you have a really stressed kid, that can also alter some blood values if we ever do blood work. So that can definitely help, at least with stress related stuff, especially with coming into the clinic. My kiddo gets really stressed and turns pink, and that could look like she has a skin infection, but she's just very stressed out, and anxiety meds definitely help a lot with that. Same thing with cats too. Cats do not like coming in, so that also helps with stress with cats.
What are commonly used medications for my dog, and when would the veterinarian recommend them?
For antibiotics, usually doctors will recommend an antibiotic if they suspect any kind of infection. If there is bacteria on the feet, the skin, if there's a UTI, which is there's bacteria in the bladder, anything where they might have found bacteria, that's when they would essentially recommend an antibiotic. As far as antiparasitics, if they have found any type of intestinal parasite, so roundworms, anything that might be found on a fecal screening, sometimes you don't. Tapeworms are very weird. They have little segments that come out, and sometimes you can't see it on a fecal. But any time where we suspect any intestinal parasite is when we would recommend antiparasitics. As far as antifungals, that's a rare one, but we have seen cases of something called ringworm. It is not necessarily like a intestinal parasite. It is a fungal infection of the skin that can spread from us to people and vice versa. So that would be an instance where an antifungal would be recommended. Sometimes fungi can grow in between the toes, and they need a special antifungal for that. There's a very rare antifungal disease that can happen that sometimes they'll recommend antifungals for, but thankfully they're not as common. As far as behavior modifying and sedative medications, that would be like what I mentioned before. If your kiddo gets really stressed, if they are pacing, won't sit still, or they have some fear-associated aggression, they try to bite, need a muzzle, anything like that, that's when we would recommend behavioral medications. It's not their fault. It's just kind of like us when we're really stressed to go into the doctor. It helps at least relieve any kind of anxiety that might be associated with it. Sometimes our shelter kids, we don't know what kind of history they've had in the past, and so they might have some triggers, and coming in we don't know that, and it's mostly just to help them have a better experience, because we don't want them to hate coming here. They obviously won't love coming here, but we don't want them to hate coming here. And we're a fear-free clinic, so we want them to at least have a moderately okay time. As far as chemotherapeutic meds, that's not something that we usually give here, but Iowa State for sure does. If there's any instance where there is a cancer, any kind of tumor issue like that, they can go to Iowa State and prescribe chemotherapeutic medication. It's kind of like chemotherapy in humans. It can be, sometimes it's really good for treating any kind of cancer, tumor. There is something called an iodine reactive treatment, and that can sometimes help with cats with hyperthyroidism. That is an instance of chemotherapy that isn't necessarily for cancer, but it does help sometimes cure hyperthyroidism in cats. As far as pain relievers, opioids, and NSAIDs, those would be recommended if for whatever reason they've hurt themselves. My kiddo was on some pain relievers because she had a issue with her knee, then she needed surgery. She got pain relievers after the surgery, before the surgery, because it's really, really painful when you have a issue with the bone and the muscle and the ligaments there. Sometimes it's even for some soft tissue injuries. So say a kiddo, we don't notice a break, but they might have had some kind of sprain, we would recommend some pain relieving medication. As well as when kiddos get older, we all get arthritis when we get older, and so sometimes we recommend pain relieving medication just to help with arthritis. Opioids, really, really deep pain. Usually if it's really, really painful, we would recommend opioids. That is something that needs to be prescribed tentatively, as well as through a pharmacy that does allow controlled substances. As far as NSAIDs go, same thing. Sometimes NSAIDs would be for pain. That's kind of like similar to human ibuprofen. We do have some of those that are for our kiddos here that are for pain, as well as some inflammation reducing. So say, once again, they have a soft tissue injury, you need a little bit of inflammation and pain management to help and see where things go if there's not a direct injury. Sometimes NSAIDs can be used for immune-related stuff too. Steroids follows into the immune-related thing. There are a variety of things that steroids can be used for. If they can't be on any other medications, they'll prescribe steroids in a scenario where their immune system is overreacting, and steroids was essentially tone down their immune system a little bit. There have been some scenarios where they've had immune-related blood issues and they undergo steroid treatment just to self-regulate their immune system so that their immune system isn't on like full throttle, 100% destroying their own blood or platelets, etc.
What are some of the side effects and adverse reactions my dog could experience from these medications?
Antibiotics. Most of these we recommend giving with food because they can cause a little bit of some stomach upset. So some GI upset can be accompanied. Sometimes a little bit of diarrhea if they have a little bit of some GI upset. As far as pain relievers and NSAIDs, sometimes they can experience black and tarry stools. Sometimes they can experience vomiting as well as diarrhea if they don't react very well or respond very well to those medications. Antifungals, that could always happen. There's almost always a chance that there could be some vomiting and diarrhea, but usually we advise you to follow certain instructions, like give with food or give on an empty stomach before giving, etc., just so we alleviate any of those adverse reactions to the medication.
Will all dog medications require a prescription?
Most of them will. There are some medications that are over the counter, such as joint supplements. There is also some probiotic for gut health that can be over the counter. There are some sedation, usually it's last resort sedation meds that can be over the counter, but don't get unless advised by your doctor.
Do I have to bring my dog into the vet's office in order to have a prescription written?
If it is for something that we've never seen them before, then yes. If it is something that they have been consistently on, such as an arthritis medication like Galliprant, if you get it through an online pharmacy, you will have to come in and pick up the paper script to take it to a separate pharmacy. But if it's just to have it refilled, you do not need to have a vet office visit. You do need at least a bare minimum recommended blood work, recommended at least annual visit before having any medications refilled, but that's really it.
Where can I get my pet's prescriptions filled?
You can get them filled at your regular clinic like such as us. We do have an online pharmacy that you can get your prescriptions through that goes straight through us techs and the doctors, keep touching the microphone, that can get approved online and shipped directly to you. As I mentioned before, you can have a paper script. You can take it to a human pharmacy as long as they do carry those meds, such as Hy-Vee, Walmart, Walgreens, any place like that.
How should I navigate drug interactions when my dog is on more than one medication?
Our doctors will usually help you navigate any kind of drug interaction. We do have some owners that keep a list. We do have a few kiddos that are on like 5 different medications, and they will have like a little written list of drug interactions and what to look for, but usually Dr. Ryan is really good. Dr. Kate is also really good about sending home emails about interactions to see between medications as well.
Do I have to follow the exact dosage instructions my veterinarian or the pharmacy gives me?
Absolutely. Do not change or stop your meds unless otherwise advised by your doctor.
If my dog is feeling better, do I have to finish the entire course of medication?
Absolutely. Just because they feel better doesn't mean that you should stop the full course. The fact that they are feeling better means the meds are working, but they haven't completely 100% healed or at least recovered. So we recommend following through the full course just in case, because we have seen some scenarios where they get better, stop medication, and then say an infection comes back.
What happens if I miss a dose of my dog's medication?
Usually, definitely check with the doctor first. It depends on the medication. Sometimes seizure meds have to be maneuvered around. Always doctor's discrepancy. If it is a medication such as a flea and tick, usually you'll just have to adjust when to give it. Most of the time, just if it's dire, make sure that you give it. You'll just have to adjust your medication schedule if it's given every 12 hours, 24 hours, etc. If they miss a dose, call your doctor, text our doctor, call them first and foremost.
How can I get my dog to take oral medication?
If they don't like taking it pill straight up, that's fair. My kiddos also don't like that. Granted, they don't have any allergies. You can put it in spray cheese, slather it up, give it to them. You can put it in wet food. You can cover it in a high-value treat. Don't mind that. You can cover it in a high-value treat, such as like a little bit of turkey. You can even wrap it in like flat cheese. Some people have, if they're small enough, have even put it in dog or pet safe fruit. If you use wet food, you can make like a little meatball around it. Some people have broken them down and mixed it into their food as sort of like a powder. Granted, it's able to. People have also requested having a liquid version of the medication because some kiddos, it is such a pain in the butt to even attempt to try and get them to take a pill. So you can have a recommendation to see if we can get it compounded as a liquid form, because sometimes liquid is a little bit easier to get down than trying to get a pill down them.
What should I do if my dog is refusing to take medication?
If he's refusing to take medication, give your doctor a call immediately just so that they can figure out what they can do if a compounding of a liquid is needed. Because in this scenario, they likely need that medication and we want to make sure that they get it.
Can I give my dog medicine meant for humans?
Would not advise that. There are some very rare scenarios where dogs and cats can have human medicine, such as Zyrtec, but do not give it without your doctor's advisory. We do not recommend it. We've had some kiddos that have passed because human medications were given and a lot of them are not meant for them, and the dosing regulation is very, very specific, so do not give any unless you call a doctor or a poison control, anyone that is knowledgeable of medication.
What's the difference between brand name, trade name, and generic name of a medication?
Brand name of a medication is essentially the company that owns said medication. Several different companies can own the same type of medication, which is the trade name. There is a trade name for all brand type medication. The brand is mostly just their specific name that they have chosen for a medication, and the generic name of a medication is similar to the trade name. It's just more kind of like not a great value brand, but it's a generic brand, kind of what you would see at the store, versus name brand and generic brand. It's a little bit cheaper and it's more generic. It's not made by a specific company that is well known for making said medication.
Is it safe to buy my dog's medications online?
If it is through our online store, absolutely. It goes through our vet techs. It goes through our doctors first. As far as Chewy in Amazon, we can give you paper scripts for going through there. We just don't usually recommend Chewy because some of their stuff sits in a warehouse for we don't know how long. And so we really don't know the quality of the medication that you're getting through them. So if you're going to choose an online source, we at least recommend our online store.
Are there any natural alternatives to medications I can use instead?
There are, definitely advised by doctor. There are some natural options. There are a lot of people that use natural supplements for omega-3s, for probiotics, but would check with our doctors beforehand, just because sometimes there are some natural options that can have a little bit of some toxicities to our kiddos, and we just want to make sure.
What can I do if I'm worried about giving my dog medication?
If you're ever worried, you can contact our main clinic. Most of us techs know the ins and outs of the medication, and if anything, we can also relay that information to the doctors. The doctors know the absolute in and outs of the medication, and they are more than willing to sit on the phone and go over every little detail of what you're worried about, how to give it, etc., etc. For Norwalk, give us a call at 515-981-0317, or West Des Moines will be 515-224-9747.